Hi friends, welcome back to the Chronic Chronicles. I'm your host Lexi, and today's episode is one that I genuinely believe every single person with a menstrual cycle should hear. And honestly, any person, period. You do not have to have a menstrual cycle to listen to this episode, but we are going to talk about education related to that. And quite frankly, I think everybody should be a little bit more informed. We're talking about something that most of us were never taught, that your menstrual cycle is not just about babies, and it's not just about your period, and it's definitely not just something to suppress or ignore. It is a vital sign, just like your heart rate, your blood pressure, or your temperature. And today I'm joined by Lisa Hendrickson-Jack, certified Fertility Awareness Educator, holistic reproductive health practitioner, and founder and author of The Fifth Vital Sign, and many other books. She's also the host of the Fertility Friday podcast, which has over 4 million downloads. In this conversation, we unpack what it actually means to treat ovulation as a marker of health, not just fertility. We talk about hormonal birth control, cycle tracking, PCOS, egg and sperm quality, inflammation, nutrition, and why regular ovulation matters. If you live with endometriosis, PCOS, irregular cycles, unexplained symptoms, or if you've ever felt dismissed when bringing up menstrual concerns, this episode is going to give you the language, it's going to give you context, and hopefully it's going to give you back a little bit of your power. Because when we understand our bodies, we advocate differently. So grab your notebook, grab your coffee, or your heating pad, whatever your version of cozy is, and let's get into it. I know that you have a few books, which I think they're so cute. They're like behind you.
Product placement.
What was your first book that you wrote?
My first book was The Fifth Vital Sign. And what's interesting about that, I started my podcast back in 2014, and that was after having charted my cycles for over a decade, I think by that point.
Wow.
And when I first started the podcast, there were no fertility awareness podcasts, period. And there were barely any fertility podcasts. So it's kind of crazy because there's hundreds now, but it's maybe thousands, but it's crazy because there really wasn't. So, after starting my podcast, I had this idea. I was like, you know what, this has really changed my life. Let me put it out there and see if anyone cares. And they did. And so the podcast was, popular, I guess, like among the small community, right? But a lot of people knew about it. But everyone would ask the same question, right? Like, why wasn't I taught this in junior high? How could I be, 20 years old, 30 years old, 40 years old, and this is the first time I'm hearing about this? And every woman should know this. So the book was essentially my way of putting into a book form what it is that we weren't taught and what it is that we should know.
Yeah.
And that's why I titled it The Fifth Vital Sign, because that's my whole premise, right? That the menstrual cycle we should be looking at as a vital sign. So it's really fun to look back because I do think that it has made a difference in how people talk about the cycle for sure.
Yeah. I felt the same way when I actually, in my master's program, I went to grad school for bacteriology and I was teaching anatomy and physiology. So embarrassing, but the first time that I learned that there were 4 different phases in my cycle was when I was teaching it. I was like, wait a minute, what's going on right now? I was like, I don't know these things. And I was like looking over like the curriculum for that semester, and I'm like, okay, we're going to talk about the menstrual cycle, which from what I was taught was like a very minimal amount, which it was really just like your menstrual part. But then the curriculum that I got was like graphs of your estrogen and your progesterone and like how they go into and you can only get pregnant during ovulation. And I'm over here like 25 being like, wait, what? I'm like, it was like a scare tactic almost. Like I was taught that, don't have sex, you'll get pregnant and die, basically. So,
Yeah. Well, one of the crazy examples that is like a real one from a real person in the book, it was like this girl that was like, yeah, my doctor told me that you're so fertile in your 20s that you could get pregnant sitting on a warm bus seat. Like, so obviously that's not true, hopefully.
Yeah.
But it's like, it just shows. So you're not alone. I feel like it was a scare tactic too. I remember in junior high, they told us that we could get pregnant on any day. And they said, even your period, and there were no safe days. And that led me to the pill, thinking that that's the only way, because it's just like a ticking time bomb, but they didn't tell you how it works. And when I discovered that it's not like that, that changed everything. And then for me, I actually came off the pill and used fertility awareness for birth control. And I felt more confident because I was able to actually understand what was going on. Like wasn't a mystery anymore what was happening in my cycle.
Yeah. Yeah, and I feel like, so like I said, a lot of the people that are probably going to listen to this episode have endometriosis, PCOS, or some other chronic illness that might affect their cycles. So even when I learned literally in grad school when I was about to teach it, what the menstrual cycle really was, and like we had these phases and you could only get pregnant during ovulation, I was like, oh, wait, okay, I kind of want to track that. But I've had IUDs for the last 12 years because I have endometriosis and that was like the primary, well, it's not, but I was told that it was the primary way to like control my endo symptoms, which isn't really true. I still get, I call it like my fake period. I'm not like actively bleeding, but I get all of the symptoms like breast tenderness. I'm sometimes spotting like, but it lasts like longer. Like my periods are definitely irregular, but I have an IUD. So it's very confusing. And then I was like, well, how am I supposed to figure out what it's just, I don't know. I feel like I don't want to demonize birth control because it does help a lot of people and like you should do it if you want to do it. But at the same time, I feel like sometimes it can make us feel out of tune with our own bodies too, because you don't really know what's going on. Like you're not having a real period, but it's very
Well,
confusing.
so you're taking, you said you have the IUD. Is it the hormonal
hmm
IUD?
I have the Mirena, so it does
Yeah.
have local hormone, progesterone, but
Yeah.
yeah.
Well, and so we could talk about that a little bit. I mean, I
Yeah.
find it interesting how the PR crew for the Marina and Skyla's, like the
hmm
hormone releasing IUDs, they say that it's local. But it's
hmm
like if I put lotion on my skin, we have a circulatory system. So it
Yeah.
starts in the uterus, but like it does go everywhere, right?
Yeah.
So interestingly, with the IUDs, like when you look at the research into how it affects the cycle, there are some women who will potentially not ovulate while
hmm
they're using it. There are other women who will ovulate kind of like consistently, like as if similar to how they would have off of it. And then there's other women whose ovulation is more disrupted, so it's more regular. So I think that's one of the interesting things about even the hormonal IUD that some women do continue ovulating, whether it's regularly or sporadically. Therefore, you still have the bleed. But then, of course, the reason you can't get pregnant is because the primary mode of action is to thin the uterine lining and to potentially block the cervical mucus with the thick mucus plug that would be there outside of your fertile window anyways. So I think it's helpful to know. And then, with the hormones, the reason that they're suggesting that type is to have some sort of effect on the bleeding patterns. Because if they were to insert a copper IUD into somebody who potentially has endo or another inflammatory condition, or even just more painful or more heavy periods, one of the most common side effects is that it makes it worse, like
Like
causes
the
more
bleeding worse.
inflammation,
Yeah.
makes the bleeding heavier, and potentially makes the cramps worse, which is why the copper IUD can't work for everybody.
Interesting. Yeah, I actually didn't even know that. I just was never given the option. They just basically said like Kylena or Mirena. And then also on top of that, I have factor V Leiden, which is a blood clotting disorder. So I'm not supposed to be on like traditional, like the pill. I shouldn't be on the
Yeah,
pill.
estrogen.
But yeah, so it was kind of like Mirena or nothing. I feel like it was really, really confusing discovering as like a 25-year-old that there are like other things happening in my body than and it's kind of embarrassing to like say out loud too, because you're like, wait, how are these things like happening in my body? And I had no idea. I also didn't even really realize that women had testosterone. Like I thought
Yeah.
that was only a male thing. And then obviously when I got diagnosed with PCOS, they were like, well, sometimes with PCOS, excess testosterone is a thing. And I'm like, wait, what? I was like, I have testosterone.
Well, and they say 90% less testosterone than men, but we do need
hmm
it, and it's important for sexual function. And I mean, it just shows one thing though that I mean, maybe because I'm a little bit older than you, but
hmm
25, although I was 25, so yeah, I would have been pissed too if I was discovering this at 25. But I've had countless emails from women who are 40 and 42, and we've
Yeah.
had women in our programs who are past cycling age who are, learning about this and didn't even get the chance to chart their cycles.
Yeah.
So I don't know if this is if it's like reassuring to you, but 25, while it's unacceptable,
Yeah.
is still
There's
better
still
than
time.
45, right?
Yeah.
And so don't be too hard on yourself. And it's nothing that you can do. We're not taught. It's not part of the
Mhm.
standard curriculum. And I mean, that's one of the reasons why I started the podcast and I wrote the books,
Mhm.
because if you're the reason that I learned about all of this information is because I discovered fertility awareness and then I trained as a fertility awareness educator. So I was in the fertility awareness world. And
Yeah.
even in our, I have a practitioner program now where we train practitioners to teach fertility awareness to their clients and use the menstrual
Mm.
cycle as a vital sign. And the thing about that too is like we're in the program, like we recommend textbooks that are only, they have certain information, but outside of the fertility awareness context, you would never even have that level of detail, even
Yeah.
seasoned medical professionals. So it's one of those things where it's people like you and like me who are willing to talk about it and educate about it. Like that's what we need, I think, in this world to really get the word
Yeah.
out. Because I'm not waiting for the schools to decide it's important. I'm not. I don't have that
No,
kind of patience.
for real. Yeah. Well, then when you like really think, I don't know, I've done like a lot of thinking on it because I'm like, well, why? Like, was it just because like my schools didn't have like the knowledge of it? And I'm like, no, this is like nationwide, not even nationwide. Like, obviously it's
Worldwide.
in Canada. Yeah. I'm like, it's all over.
Yeah.
Like, no one, which is crazy to me, but that's a whole nother topic.
Well, it is. And to go down that rabbit trail for 1 second, even when we look at science and how things are studied, and
Hmm.
I recently, I was like, tell everybody, tell your friends. I recently had Dr. Sarah Hill on
Hmm.
my podcast, and she just released her new book, Period Brain. So I knew that most science is done on males and male animals because I spend a lot of
Right.
time reading research. But she kind of brought to my attention that it's like worse than that. So
Mhm.
even when they bring in female animals into research, they have this practice of oophorectomizing them, meaning that they'll take out the ovaries so that they can study them without any hormonal changes, even though that's what makes us female. And
Yeah.
even when they study women, so I look at a lot of research from the fertility awareness standpoint. So I'm highly critical of how they'll test for hormones,
Yeah.
because in the research they'll maybe make there was a study that I talked about on the podcast a little while ago, and it was a study about PMDD, and so they were looking
Hmm.
at women who had PMDD versus women who did not. And they determined that there was no difference in hormones. So they compared the hormones of the
Yeah.
PMDD women and the control group, and they said there's no difference in hormones. So it must be that the PMDD women are just more sensitive. And that was their, conclusion. And
Okay.
what's interesting about that is that when you look at how they tested these hormones, they had these women, but they would test once in the follicular and once near the mid-luteal. And that's how they determined that the hormones were the same. But anybody
Yeah.
who understands the menstrual cycle or cycle tracking would know that. So let's say the luteal phase. So for anyone who's not familiar with all these terms,
Hmm.
the follicular would be from your period until ovulation, and then the
Hmm.
luteal would be from ovulation until your next period. So a healthy luteal phase is supposed to be 12 to 14 days. If you have somebody with low progesterone, it's not always showing low in the middle.
Yeah.
It's the last week before your period that it drops off, or that, maybe the luteal phase is too short, or those kinds of things. So even the way that they test and make full on like
Yeah, like
claims and
scientific
decisions,
claims. Yeah.
I would say that they lack the understanding of the menstrual cycle to do a real test so that we could really know. So for example, if I ran the world and I I was in charge of the study, which I'm not, I would want in, and it would be very expensive. Like I understand it would be expensive. It would be like it just wouldn't be convenient. But
Yeah.
in order to get a good picture of what's really happening hormonally between these two groups, I would say that you would need to test progesterone at least once every like 3 days
Hmm.
so that you could actually plot that arc
Yeah.
of what's happening, right? So that's kind of, I'm usually critical about research in that sense and looking at the menstrual cycle. But back to Dr. Hill. So
Hmm.
when they test women, let's say for drug, if they're doing a drug trial and they want to see
Yeah.
if it works, they'll test them, but only during the first few days of their menstrual cycle because they want to test them before the hormone. Like it's just insane. But they're thinking the hormones make everything complicated. So we have to test them
Yeah,
before the
but that's the
hormones.
whole point.
Correct. So back to like, why is this not in schools and why are we
Hmm.
not taught? I mean, I feel like science hasn't even figured out what women are if we're testing them
Yeah.
like that.
Yeah, no, I 100% agree. And I mean, there are so many things that it goes back to, but I feel like it really, really goes back to like, unfortunately, the patriarchy and the fact that like women are complicated. Like that's what the world thinks is that,
Yeah.
well, we have funky hormones, so we're complicated. And it's like,
Well,
well,
the standard is men. And so
yeah.
instead of acknowledging the sex differences
Hmm.
and actually thinking that they're valid,
Yeah.
and making a point of figuring it out, they're just doing, I would say, the easy, lazy thing,
Yeah.
which is just to kind of try to make women like men. And
Yeah.
for anyone who's not sure of like why this would make a difference, so when they're testing these drugs, but they're not testing them when we have hormones. So they're missing the point where our estrogen is really high before ovulation. They're missing the point where the progesterone literally skyrockets post ovulation. The amount of progesterone we produce after ovulation is very significant, and we don't produce significant progesterone before. So if you're testing women, outside of that, and and you're not looking at what's going on in their hormones, then when they come out with these drugs and they say they're fine, all these women are having side effects, and so
Yeah. And
yeah,
it's like,
like
because it's
it's a
actually not
systemic,
fine during the whole
because you
process,
don't
which is,
even know.
yeah.
You didn't even test it. So as women, we're just the unfortunate reality is that we're just not I honestly, after learning that, I just feel like they don't even know. And it goes even beyond that, but it's not important. Obviously, it's not on the top of their agenda. But
Yeah.
furthermore, they haven't even studied us enough to know what's going on,
Hmm.
because they just don't seem to be concerned to do so.
It's a whole thing. It's a whole thing. And it's so frustrating when you like really look into it. And I totally agree too, because I spend a lot of time reading research papers as well. And I feel like, unfortunately, too, that's a skill that like a lot of people just don't have. Like they read research papers and they're like, oh, well, they came out with this, so like this is safe, or like this is what they found. And I'm like, but did you read like the criteria they were using? Did you read the sample size? Did you read who they were performing these on? Um,
How long they used it for,
yeah.
like,
Did you read the discussion on what they actually like? Sure, they might tell you what they found, but like, what did they actually think of what they found? And there's just like so much that goes into research and research papers, and yeah. And that's the hard thing with social media too. But that's also part of the reason why I wanted to do the podcast, is I'm like, okay, it gives us a place to like talk about these things and really look into it.
well,
Uh,
and about because I mean, I could talk about research all day, but to kind of piggyback on what you were saying, it's like
mhm.
I'm really happy that we live in a time where we have access to so much research.
Yeah.
It has allowed me to expand on these topics, and especially with a topic like fertility awareness, which isn't necessarily looked at to be, it's not accepted as, if you look at the actual studies on fertility awareness or doctors' attitudes towards fertility awareness based methods, even to this day, a lot of physicians and other health professionals don't think of it as a legitimate method and all of that. So I
Yeah.
am very thankful that we live in a time where we have access to research. So when I'm talking about these topics, it's not just Lisa thinks this or whatever. It's we can
Hmm.
actually show a lot of evidence and research. But with that said, I think the problem is when we start thinking of research as like sacred, or you have to
Hmm.
understand that research is written by people who
Yeah.
have biases. And I
Mhm.
think you have to read a lot of different papers to start to kind of get it. But like you said, I've seen papers where the abstract doesn't even hold the most interesting piece of data because it
Yeah,
confounded the researchers. They didn't expect to see this thing, and they don't know what
exactly.
to do with it, and they explain it away in their discussion. And so, yeah, in order to be able to truly understand what's going on here, we have to acknowledge how important research is, but be able to be able to actually critically review it
Yeah.
and understand the limitations of the study, what could have been
Hmm.
better, and why certain studies are finding a positive result and other ones are finding a negative. Like you have to read
Yeah.
enough of them to kind of be able to start seeing these patterns.
Yeah, 100% agree. And I mean, I obviously went to grad school, but also, so I was doing research then, but then my job post grad, I was working in an FDA regulated like research facility. So I'm like, I know a lot. I've seen a lot. Like, I
The
understand.
stories you could tell,
Yeah, I'm like,
girl.
I have NDAs, unfortunately. But yeah, I'm like, right. Like worked in a facility where I mean, I personally didn't do animal studies, but like we had animals in the facility. Like, yeah. I'm like, I know what's. So I definitely read research papers with like a different eye on them because I'm just like, yeah, I get it. But that's I would love to put out like a free class or something, like how to critically think about research papers. Because I mean, they're obviously very important. Like a lot of things need to be studied, like everything needs to be studied. But at the same time, they're not law. They're not like there's exceptions to so many things that are happening. Um, yeah, it's just a lot of nuance that goes into them. But
Well, I did a little class, like a little teaching session for
mhm.
our alumni practitioners. So the ones who've already graduated but are still in the program. And one
Yeah.
of the topics I talked on was research. And I was sitting there preparing for this and I was trying to think through, how do I share my process when it comes to finding research and reading it?
Yeah.
And all I can say to contribute to that part of the conversations, I think a lot of people have opinions and then they look for papers to confirm them. So
Hmm.
potentially, maybe that's how you wrote papers in school. Maybe
Yeah.
you had your opinions already, but you were like, oh, I need citations. So then you found papers
Hmm.
to support your already preconceived ideas. I think a lot of people do that. I don't know if it's just
Yeah.
me, but that's what I think. And so, but when I'm writing these, like when I've written my books, it was not a weekend project.
Yeah.
The first book took me 2 years, and then the second book that I like the Real Food for Fertility that Lily Nichols and I co-authored, that was a 3 year project for both of us. But one of the reasons that it took so long is because I don't start writing even a topic that I know about. I pull, maybe 20 to 50 papers and I kind of like sift through and like see the ones that are most relevant or whatever. And then I go through and read, a whole bunch on the topic. And by doing that, I am, I know I have my own biases. I know I go into this with my own opinions, but I have many times you read about the topic and then you have to kind of acknowledge like, oh, okay, so anyways, I think you see what I'm saying. Like
Yeah.
if
No,
all
I
you're
totally agree.
doing is using like finding a citation to prove your bias, then you're not
Yeah.
really an expert in the topic. But when you actually dive into the research and look at like if you don't understand why some papers show yes and some papers show no and why,
Hmm.
if you don't really get into the weeds and understand that, then you won't really understand that topic thoroughly and be able to speak intelligently on it.
Yeah. I 100% agree. And I do think that I feel like, first of all, we're all human, so we go into things with biases like that. And that's like another thing in science that people are like, oh, well, I'm not being biased in it. Like, I did research in it. And I'm like, well, you're human. Like, we all have opinions and things, even if you go into it saying that you don't. But that is another thing that I did, like, especially with like my thesis for grad school. Like, I'm like, you have to look at all of the things, like even things that are supporting your topic, things that are not supporting your topic. And that's supposed to be the scientific method is you do both. You write what you find, not just results that support what you're writing about. Like that is the whole point of it is for it
Well,
to
and
be.
if
But
like you have a certain perspective, you should
mhm.
be able to read the research because in
Yeah.
every topic there are papers that support even like vitamin D and fertility. Like there's papers that show positive result and negative, and so it's
Hmm.
important to be able to read the contrary opinion so that you can understand why.
Yeah.
I think that that makes you a well-rounded human even.
At least people listening will take away like a little bit more in research, which is great because it's definitely something that I get frustrated with on the internet sometimes is
Well, I
because
could give you a tangible because I was thinking like for someone who's kind of like because we're talking a little bit, up there, but I can give a tangible example. Written a lot about the birth control pill. We've talked a lot about
yeah,
that. We've even talked a little bit about it here. And as a young woman before I had my podcast, I wasn't a fan. I'm not a fan of the birth control pill. I've talked a
hmm,
lot about how it, shuts down ovulation and if I'm saying the menstrual cycle is a vital sign, then I'm saying that if there's an issue with the cycle, it means that there's an underlying problem.
yeah,
So, when we're using the pill to say regulate the cycle for women with PCOS, it doesn't regulate the cycle. So, but when I read through the research, a lot of people are out there saying the pill has like a permanent negative. I don't know if people really say that, but people will talk about the negative effect that the pill has on fertility.
yeah. People do. That's like a big thing on the internet too. Is like people.
Yeah.
There's just so many like scare things on the
Yeah.
internet right now, which is like a hard time to be a young woman because you're like, oh my God, there's like so many things both ways. Like I don't know what to do. But that's
Yeah.
where the research really does, like being able to go in and read it.
Well, so and just as an example of, when I go through the research about the pill and its
Hmm.
potential effect on fertility, there's certain papers that show us certain things.
Yeah.
There's research where they test women's ovarian reserve parameters on the pill and off the pill. Women on the pill, the reserve ovarian reserve parameters are lower, and the
Hmm.
research shows that it can take anywhere from 6 to 12 months for it to normalize.
Right.
There's other research that looks at the time to pregnancy for women. And so, generally speaking, when women are on the pill, if they've been on the pill long term, which is considered 2 years or more, it can. There was an interesting paper that I referred to that found that women who were using condoms or non-hormonal methods, it took about twice as long for women who were using like the regular combined contraceptive pill to
Yeah.
conceive. But nowhere in the research was there an indication that it's a permanent effect.
Hmm.
So instead of going like kind of just like whatever you think and just going on, because I don't remember. It's been so long that I've been familiar with this research. I don't really remember what I thought before. But I think I did, I might have thought that there was a permanent negative effect. But then when I was looking at the research, there's a temporary suppressive effect. So I'm able to speak about it in an evidence-based way. I'm able to go back on the research instead of just letting my personal opinions cloud whatever I talk about. So that would be an example of like if you go into it thinking this is what I'm going to find, you might not be open to actually reading all the research that's there and actually coming to a meaningful conclusion.
Somehow getting like a more well-rounded opinion on it. Yeah, I feel the same way. I think that it's hard. There's so many things right now that like I especially related to fertility. There's also just I'm trying to figure out how I want to say this, but there's so many things that I was told by medical professionals like 7 years ago when I was diagnosed with endo that now I'm like, wait, like, is this true? Did you actually even know enough information to say that? So, like, for example, when I got diagnosed with endometriosis, my the OBGYN told me that I should hurry up and freeze my eggs because I will have major fertility problems when I get older, when I want to start conceiving, and like almost pressured me to either get pregnant. Like she even suggested being a surrogate because she was like, well, that'll conserve your fertility. Like when I was like 19. And I'm like, I don't know what's going on. Like I just got diagnosed with this like chronic condition that I'm still confused about. You hurry up and put me on an IUD. And now you're telling me to like freeze my eggs, which costs thousands and thousands of dollars that I don't have, or just get pregnant like right now because that'll help preserve my fertility. Like I was so confused, and I've always wanted to have kids, so I like those are things that I like actually considered as like a 19, 20-year-old. And now like 7 years later, I'm 27 and I'm like still in the back of my head, like it scares me like every day because I'm like, the longer I push it out, am I like gonna lose my fertility? Do I even have fertility? She told me that endo really affects my fertility. Like, I don't know what's going on. And I feel like we just don't have enough information. And that's also a very common thing that through the podcast, I've heard so many people say the exact same thing. And so many like young women get hysterectomies and stuff like that because they were told that they are infertile right now anyways because of endo. And it's just all very confusing. So,
Yeah. Oh man. I mean, of course it makes me sad and a little bit infuriated to hear because the one thing that's challenging in our culture is that we really do elevate doctors to this like level above what they should
right.
be, like this kind of idea, like doctor is God and they know everything.
Yeah.
And so I think one thing to consider with anything
Hmm.
is if you're getting a diagnosis for something, if you've been diagnosed with something, if you have a medical professional telling you that you need to have a procedure done, whatever, I think that it's really important always to get a second opinion. And I mean, if you've ever been to like a hairdresser, we know that not all hairdressers are the same, right? Like some of them are really good. Some of
Yeah.
them will like, whew,
Yeah.
and we have this, I don't know why we give all doctors a pass, but
Hmm.
everybody isn't the same and all
Yeah.
physicians are not equal. And the other thing with a specialized condition like endometriosis, all what I've learned over the years, and I'm sure that you talk about this all the time, is that you're going to get better results when you work with somebody where that's all they do, where that's
Yeah.
their specialization and they do a data. I learned this even just as a podcaster because
Yeah.
the conversations that I would have with the doctor who's studied this condition, who's specialized their practice, and that's all that they work with, who's written the book, who discovered the limitations of what they were taught or not taught in school and took it upon themselves to take additional specialized trainings on that topic or attend a fellowship of this university that specialized in that condition. Whatever they learned in med school isn't enough to really support you with endo. So having always getting a second opinion, but if you have a specialized condition, finding the doctor who that's all they do. And
Yeah.
I would go a step further and say, in addition to your MD or your fertility specialist, you probably want a functional doc. You probably want to talk to somebody, and again, just not a general run of the mill, but if you're going to a naturopath or a functional doc, find the one that deals with endo day and night. Find the one that like that's what they do because the quality of the information you will hear is night and day. Nobody knows. I'm sorry, I'm like fully on my soapbox, but nobody knows. Like
No,
it's
but
it's
it's so
it's
true.
totally ridiculous to sit there in an office with a 19-year-old and tell them that they won't be able to get pregnant.
I know.
That is not something anybody knows. And so if someone has told you something like that, it
Hmm.
and again, like correct me if I'm wrong, did they test you? No. Like
No.
like was it so this is my issue, right? Like you hit like the ooh, it's like you're sitting there in an office and this person is telling you things like and you won't be able to get pregnant and you'll have
Yeah.
a hard time conceiving. But they're telling you that have they done an ultrasound? Have they done an MRI? Have they done a blood test? Did they do a swab? Like
Yeah.
based on what? Based on their opinion. And everyone has opinions. Like you didn't go to the doctor for their opinion, really. Like you went for their training and so anyways, this is it's a big topic, but like as women, we have to stop giving them so much power and like understanding the difference between an opinion.
Yeah. An opinion and like actual like
Yeah.
medical fact, like you did fertility testing and you're telling me that. Or I tried to get pregnant for however long and it's not happening. Like then yeah, okay, there's like
Yeah,
something
but
going
not
on.
like you're 19 years old. You've never tried to get pregnant before. I literally haven't done we haven't done an ultrasound. We haven't done an MRI.
Yeah,
We've
I'm
never done any
on an
fertility testing,
IUD. Like,
but you're gonna tell me that I can never have kids based on your imagination.
no, it literally was that. It was from her being like, okay, you have stage 4 endometriosis. Like, you should
And was
probably just
that
do it now.
I'm being nosy here,
No,
but
yeah,
was that diagnosed with a
yeah,
like an
yeah.
actual okay, good.
But not, it was with an OBGYN through an ablation. So she, yeah, just saw it and was like, okay, you have it. Which was like a whole thing the nightmare situation. Very small town in Michigan. I was young, like I didn't know. And I didn't know excisions existed. I didn't know endometriosis specialists existed. I didn't know any of that. So I just went to her. And like looking, that's the thing. Like as an I mean older, I'm 27, but like growing into like adulthood and like understanding now, okay, probably shouldn't have went to somebody who just delivers babies all day and like doesn't really have that much knowledge into endometriosis. Probably should have went to an endo specialist. Didn't know they existed. But also now looking at it, like I would have like I definitely suggest getting excision surgery versus an ablation. Like there are pros
Of
to
course.
that. Like, there's just a lot of things I would do differently, but I was young, I didn't know. And even now, like I like my primary physician is a naturopath who also has like education in endometriosis, which I get way better. And I still do see like Western medicine, I still do see an MD, but like I get way better treatment with somebody who actually like knows about endo. Even last week I had to find potentially a new primary because mine stopped taking insurance, but went and saw her and I like mentioned endo and she just like knew nothing about it, which is not her fault. I understand she's a primary, but like it was just such a frustrating experience. She's like, well, like so did you get a blood test to get diagnosed? And I was like, no, I had surgery. Like, that's how you get diagnosed. And she was like, right, okay, so what do you want me to do to help with your endo? And I was like, no, no, I don't want you to do anything to help with my, I was like, I just want you to do like yearly physical, like, I just need you to be like a primary, whole thing.
Yeah.
Anyways, tangent. I want to go back into, I want to go back into like the vital sign. Um, so what does it actually mean to call the menstrual cycle your fifth vital sign? Why do you think that way?
Yeah, I mean, when you look at, so a vital sign is simply a way to measure how the body is functioning. And when we look at the vital signs that we are most familiar with, things like our
Hmm.
body temperature or our respiratory rate, heart
Yeah.
rate, blood pressure, if you go to a doctor, your primary, and they measure
Hmm.
your blood pressure, they're if the blood pressure is too high, for example, it gives some general information that something's wrong, but
Yeah.
your doctor is familiar with some of the potential causes for high blood pressure. So beyond general information, it also kind of gives a roadmap of where to start and what to look for. And
Yeah.
so, interestingly, the menstrual cycle does a very similar thing. When we understand what a normal menstrual cycle looks like, what the normal parameters are, and
Hmm.
not just the period. I know you mentioned, before it was kind of like, oh, it's just the period. But
Yeah.
when I talk about the menstrual cycle, it's really from the first day of your bleed until the day before your next bleed. And so we have already talked a little bit about the different phases of the cycle. We can divide the cycle in
Hmm.
half. We could talk about the pre-ovulatory or follicular phase and the post-ovulatory or luteal phase. And of course, we can further break it down into the four, stages of the menstrual cycle.
Hmm.
But when we look at those different phases, there's a lot of opportunity for, even just basic information. Like if you have continuous discharge, that could indicate something like an infection, or something more
Hmm.
serious, where if you have long, irregular cycles, that might indicate PCOS, and that's a condition characterized by insulin resistance, inflammation, glucose intolerance. Or if you just don't get a period for 6 months, but you're of reproductive age and you're not pregnant, or something like that, that can indicate hypothalamic amenorrhea, which is characterized by overexercise, stress, and undereating. And for example, if a woman of reproductive age goes months and months and months without a period, that's also associated with a greater lifetime risk of osteoporosis. And just like if a woman has PCOS, the insulin resistant type, she has double the chance of lifetime risk of developing diabetes. So interestingly, our menstrual cycle is reflecting what's happening in our bodies, but we're not taught to look at it. So instead, we're taught, oh, if there's an issue with your cycle, you got a regular cycle, you got abnormal bleeding, like, let's just get you on the pill. Oh, you got pain with your period, let's just get you on the pill. But what the pill does is it just shuts down the whole conversation. And if you, for example, did have insulin resistant PCOS, and instead of addressing it and, you know, figuring out what was going on and normalizing the cycle naturally, they just put you on the pill. The pill will give you a bleed every 28 days, which is not the same thing as a true menstrual period, but it doesn't fix the insulin resistant PCOS. So like you could be on the pill and that condition can still be going on in the background, but you got your bleed every 28 days, giving you a little pat on the back. And I would say that false reassurance could make it so that you're not really looking into the problem. And then when you're ready to have babies and you come off of it, you're more likely, for your period to take longer to return or to still be irregular. Doctor will say, oh, we'll just give you Clomid and we'll just all of that. We'll just let you. But then at no point are we actually trying to fix the problem.
Yeah. So I do have insulin resistant PCOS, and something that I didn't, my naturopath figured it out like 2 years ago or a year and a half ago, something like that. And I have been like, if you look at my labs for the past 5 years, you can see that it's happening. But I didn't know that. And the doctor that I was seeing, like, I guess, wasn't looking at it like that, like holistically, even though I've had symptoms for years, like tons of symptoms. And now in the last 2.5 years, I've gained 40 pounds that I have like literally, even though I'm trying to lose weight, like working out, nothing really has changed outside of now I'm like, I've been trying to lose weight for this whole time and I can't. And my insulin resistance is getting worse, which is like something that I've been trying to figure out with my doctor too. But part of that, like I've been talking with my doctor and I'm like, okay, well, do I take out my IUD and try to figure out like if my cycles are completely out of whack? And she's like, Well, I mean, they are because based off of how like your hormones are, but now it's all just like I'm engaged, so we have a wedding next year. So I'm like, well, I don't want to accidentally get pregnant like before a wedding, but
Well,
it's
so
a
we
whole
could,
thing.
if you want to talk a little bit about, because in the book, not necessarily,
Hmm.
not to put like you on blast, not necessarily
Oh
about
yeah.
your specific situation, but in the book, I do talk about just it's talking about the birth control pill, talking about planning to conceive, and potential strategies for that.
Yeah.
Because uh, I mean, when you were put on hormonal birth control because you had an issue with your cycle,
Yeah.
what's really interesting, so again, going back to the research, if we were to look at a whole bunch of studies, like recent studies with contraceptives and time to pregnancy, most of the studies will say something like, you know, between 75 and 80% of women conceived within a year of coming off of birth control. And so they say, and if you read a lot of research, you start to see the things that they have to say in order to get it published. So hormonal contraceptive is a reversible, they always say it's the same phrasing. It's a reversible contraceptive method. If you look at those studies, they specifically exclude you, Lexi. So like anybody who had, if you had PCOS, if you had irregular cycles, if you had any type of issue, endometriosis, whatever, you are not included in the study. So when they're saying that, 75 to 80% of women, conceive within a year of coming off, they are not including you. And they also don't break it down month to month. So when they say within a year, like it could be that you came off and you didn't get pregnant for 12 months. And then in month 12, you got pregnant. So when we find, and sometimes they're harder to find, but when you find studies that actually looked at women who did have cycle irregularities or other,
Hmm.
contraindications or whatever for the pill, then you find that it does take longer after they come off statistically for their first period to come and longer for those cycles to normalize. So you're in a category right off the bat where we just don't know, right? Like you could come off and sure, your cycles could just be totally, 29 days average or whatever. But given everything that you've said, anyone in a situation similar, you're more likely for it to take longer for the first period to return. And
Hmm.
also, after the first period returns, we're in that post-pill transition phase where it does take some time for the cycles to normalize. And for women who have these pre-existing issues, it's going to take longer. When you say that you're planning to get married next year,
Hmm.
and you say, oh, and I don't want to get pregnant now. I've heard this before.
Hmm.
What I would say is, well, you're 27, you're not 19.
Hmm.
You like, I'm not putting, I'll just be frank, but like,
Yeah. No, you're
I'm
good.
totally not telling you what to do. Like, I'm not, I just want to use it as an example because you brought
No,
it
you're
up.
okay. I use
Um,
myself for an example with
okay.
on the podcast all the time
Yeah.
because I'm like, other people
Okay.
are probably in the same. So
Yeah. But I don't want anyone to think like I'm telling you, like, you have to do,
no,
because
no,
I'm not.
no.
Like, I'm providing information. And at the end of the day, like, everyone makes their own choice. But the problem is, I would say that no one tells you about like option B, which is what I'm saying.
Yeah.
So, like, when I say like you're 27 and you're not 19, when I was 19, I was in a different mindset. I think sometimes like we're so scared of getting pregnant unintentionally because of the programming that, oh, you get pregnant,
Yeah.
the warm bus seat, remember? So like
Yeah.
we're so scared, right? But then we're not told about how our fertility changes and we're not told about how different challenges could affect it. And so I think because of that, we're so like it has to be hormonal contraceptive because otherwise I'm going to get pregnant. It's going to be an accident or whatever. But you are, like you're a grown up. So
Yeah.
if you and your partner, if you decided that this was the right decision for you, the two of you could work out how to sort out the pregnancy like issue without
Yeah.
hormones. Like you're
Yeah.
capable and like, you're clearly like a research background, like you
Yeah.
you know what I mean? So I think sometimes we sell ourselves short because we kind of think, and as long as your partner isn't like a monster, which I have,
No, yeah.
I've worked with like so many women of, I find like, I always joke that like, if you're partnered with a male, right?
Hmm.
He's just happy that you're willing to take your clothes off sometimes. Like, you know what I mean? So I feel like they're not like, right? They're not, so
No,
anyway, so
literally.
that's
I
the
mean,
first thing.
if I told my fiance, "Hey, I want to get off my IUD, but like I don't want even the slimmest chance that we would get pregnant before the wedding," he'd be like, "Okay, we don't have sex for the next year. Whatever. Like if that's what you
Well, and
need."
I'm not
Like,
necessarily, well, yes, that's a
but
good
yes,
example, but
but
I'm
like
not necessarily going there, but
even if we went to like the highest extreme, like
yeah.
yeah, I mean, I could yes. But
Okay. So again, hypothetically, The point that I'm making though is that there are effective non-hormonal methods. Not everybody loves condoms, but
Hmm.
there are other ways to do this without hormones, is what I'm saying. So my advice and recommendation for women in a similar situation, and so to specify, in a situation where you were put on birth control because you had some sort of issue, whether it be endo,
Yeah.
PCOS, irregular cycles, acne, PMS, whatever, PMDD,
Hmm.
if you were put on the pill for a specific issue, then I would say that you would want to consider coming off 18 months to 2 years before you're ready to start trying. Meaning that I actually recommend for women in that specific situation to think about coming off when you're literally like, I don't want to get pregnant. And
Hmm.
taking that time, obviously you have to have protective measures. You have to, come up with what you're going to
Yeah.
do when you're sexually active. But you have that opportunity then to start charting because this is what happens. This is the reason why I make this recommendation. Let me give you two scenarios. Okay. And I've seen both because I've worked with clients in both. So client A did what I suggested. She came off the pill. She's like totally terrified of getting pregnant. We work through that, like, right? But she figures it out. Her and her partner, maybe they start using condoms, whatever. I've had clients who like their partner has the condom on and they also withdraw. So like there's ways to
Yeah.
sort this out, right? But during that time, she comes off the pill. Maybe it takes her like 2 or 3 months for her first cycle to come back. And
Hmm.
so she's like stressed, but like she's not stressed because she can't get pregnant right now. She's like it's a totally different thing. She's just, because she's just waiting for it to come back. And so then her cycles come back. We start charting. And, maybe the first cycles are longer. Maybe they're like 45, 50 days, which again is kind of stressful. But she's able to kind of work it out. She works on her diet. She learns a bit. Like if it's insulin resistant PCOS, she really
Hmm.
starts to learn about nutrition. It starts, eating in a way that's supportive of that. There's certain key nutrient deficiencies that are really common with PCOS. She starts addressing those. She works with her functional practitioner as well, all the things.
Yeah.
And so she starts working on it. And by a year out, her cycles are starting to normalize. Maybe they're not fully in the 29-day range, but maybe now they're finally in like the 35-day range. By 18 months, maybe she finally had her first cycle that's 28 days. She's got good mucus. She really just knows what's going on. She's, on her dietary stuff or whatever. And in that example, I said 2 years before she was trying to get pregnant. So all of that unfolded and sorted itself out so that when she's ready to get pregnant, it can happen fast. And do I even have to say scenario B? Because scenario B is the same, except that she's super stressed by month 3 and like teary, crying already at the fertility clinic when she's still in the post-pill transition phase.
Yeah.
And no one told her that she would need time for her cycle to kind of unfold and time for her to figure this out.
But that is like super helpful to hear because it's like, well, you hear about all these stories about people, like even my cousin but it's just different scenarios. Like my cousin, for example, you know, took her IUD out and got pregnant like the next month, not trying, like it was an
Yeah.
accident,
Yeah.
but she doesn't have PCOS and she doesn't have endometriosis and she's always had pretty regular cycles. I've always
And she
had,
obviously had sex on a fertile day.
right, like something. So like you hear about all these stories and then it's like, oh God, like I don't want to be potentially dealing with like a pregnancy on my wedding day. But at the same time, there's also like at the same time I'm 27, about to be 28 in a couple of weeks. Like if it were to happen, it would happen and we would figure it out. Like it's not like I'm 19 and in college and like scared. But it is. It's like pregnancy is always kind of just like I'm still a teenager even though I'm not.
Well, and I guess I don't have the right answer. Every couple, every person has to decide for themselves. I just feel like I grew up in a different time. So I graduated high school in 2000. And at that time, they were pushing condoms because they were talking about AIDS all the time. It was like AIDS
Mm,
was the whole conversation. If you
wow.
have sex, you're gonna get AIDS and die. That was my literally anyone who's my age, it's like, oh yeah, that's what they said to us. So in addition to like that, but for your
Wow.
generation, oh yeah, yeah, it was if you have sex, you're gonna get AIDS and die, and so you need to wear condoms or not have sex. And so,
Yeah.
so
That's just
my
so
point,
crazy
yeah.
considering now, like it's you can control it. I mean, you can control HIV
Yeah.
so well. So it's just like,
Yeah.
wow.
But the point I'm making is that when I grew up, they taught us that condoms worked. So I didn't
Yeah.
like leave high school thinking that condoms weren't effective. But I feel like with
Right.
your generation, you're the generation where the pharmaceutical companies really wanted to solidify the idea that without hormonal contraceptives, you will 100% get pregnant. So I
Yeah.
find, and this is like, love you guys, but I find that your generation is like, you don't think condoms work.
Yeah.
And I think that that's really fascinating because with perfect use, they're 98% effective. So I
That, you
find
know
it to be
what?
like
That
completely
is
wild
really
that like you guys I feel bad for you because I feel like then you were totally like that this is the pharmaceutical industry captured you all to make sure that you would be customers forever because they have you so terrified that you think that if you stop using the pill, you're going to get pregnant immediately and there's no other alternative. And I'm like, that is literally not true.
No, but like you're 100% right. I mean, obviously we like had access to condoms, but when I really think about it, I guess I'm like outing my whole generation, but I don't think many of us do use condoms.
And you
Like,
don't even know how to use it because you guys are
yeah.
using it with like coconut oil and stuff. Like you don't even know that you're not supposed to do that. It's completely out of control. Like I did this like in-person thing and I was talking about condom use and I was like, how many of you knew that you couldn't use the condoms with oil? And it was like less than half the room. And I'm like, what is happening? So
Yeah,
yeah,
I
the
don't think I
sex
knew
ed
that either.
sucks. Yeah,
I don't think I
that's
knew
what I'm
that
saying.
either.
And that's maybe why all you guys are getting pregnant with the condoms because you don't even know how to use them. Silicone or water-based lubricant. Okay, look it up.
Oh my God. That is hilarious. I mean, it's not funny. It's funny, but it's not funny.
And
But
here you are. It's like I'm 27 years old. And literally, I just did a podcast interview and I was taught how to use condoms. What is going
ah,
on?
little did I know that they were actually effective. No, I do feel like majority of like when I'm thinking about my friend group, like yeah, majority of us don't use condoms. We just use hormonal birth control, and then we're like, well, okay, this is good. But
Well, and I feel like so I have more opinions. And so again, feel free to be like, Lisa, you're totally wrong. You're out of line. So I feel like because of the pill situation, there seems to have been an expectation for, like, I don't know if it's a self-imposed expectation or a real one, but there also seems to be this expectation that the women are going to be on the pill. So the
yeah,
men have an entitlement to think like, so as someone who's always, I've only ever used fertility awareness, and barrier methods in my sexual history. So TMI, whatever it is. And so every single like at any partner that I've ever had, there was always a conversation because you just literally don't get access to my body whenever you want. There's always limits
right.
on that. Like like unless you want to have a like baby tonight,
Hmm.
there's like, you know what I mean? So there was always a conversation that had to be had. And so therefore I had to be comfortable having that conversation. I had to be comfortable advocating for that. You know, the communication had to be there. And I feel like with the pill, what I've seen is that then maybe there's less conversation. I've had many conversations with younger clients who don't even feel comfortable telling their partner if the sex is uncomfortable.
Oh,
Stuff like that, right? Because and
yeah.
I'm not saying it's just one issue or another, but I'm saying that if there's an expectation that you're on the pill, then are you even you never even had to talk about it.
Yeah. Honestly, like no, I don't think I have. I mean, granted, my fiance and I have been together for 10 years, so like since we were 17. But like even like any conversation was I have an ID. So like we're good. Like there was never yeah. I mean, obviously we have conversations now like as we've
Well,
grown and
there's no
everything,
method that's
but
100% effective either. So I would say, like,
right.
even as scary as it is, like, there's a tiny, tiny failure rate for IUDs.
Right.
There's a failure rate for all. So it's interesting because in the world of fertility awareness, if you're choosing to chart your cycles and use barrier methods, we all know that there has to be a conversation about what happens if. But when you're on the pill, why is there no conversation?
I know. That's
It's not
interesting.
90, it's not 100%. It's like a typical use for the pill is scary for people. It's like 93% or something. It's not
Oh
100.
God.
Typical
No, I didn't know
use,
that.
not perfect
Yeah.
use. Yeah. Oh
Yeah.
yeah. Like it's like no, but yeah. So there's a whole
Hmm.
it's just a different mindset. So that's why I like to have these conversations because this is information as young women that we're not getting. And when you're 19 and you're terrified of getting pregnant, you might have made a choice for how you're going to avoid pregnancy. I always say that when by the time you reach 30, maybe even before that, you should if like you should really seriously consider your type of birth control because
Yeah.
potentially that choice that you made when you were 18 or 17 or 19 or 20, maybe that's not the best choice for you moving into your 30s because as we move into our 30s, fertility changes.
Hmm.
And so, you don't necessarily have 2 years or a year for your body to come out down off that transition phase. So I
Right.
feel like as we get older, we may want to start, especially if you're in a stable relationship now, you're older, you're like, again, talk yourself off the ledge, like you can handle this, right? But it's like when you get into that stage, it's very possible that if you want children in the future, that we should be rethinking the type of birth control, moving away from the hormonal options because of that transition phase that is about a year. It doesn't mean you can't get pregnant for a year. Don't get me wrong. That's not what it means. But there is a temporary period of subfertility. And so some women, yes, they get the IUD out and they're pregnant within 2 weeks. But other women don't get pregnant for 4 months or 6 months or 8 months. And you don't know which one it's going to be.
Right. I think my last question for you is, what's your advice to someone who throughout this conversation is realizing that they were just not taught much about their cycle? Where do they go next?
Well, that's a great question. I mean, for the person who's in that situation, I mean,
Mhm.
you're in such a better position than I was. Like when I graduated in 2000, there were no smartphones, cell phones, there was no social media. People went to libraries, to
Yeah.
get books on this stuff. Do you
You
remember
know
what a
what?
library is?
Funny enough, I actually rediscovered the library recently. And mostly because I have a Kindle and I was like, oh my God, I'm spending so much fucking money trying to get books on my Kindle. And then I was like, there's this library that I pass by like every day. I wonder how much it is to get a library card. It's free.
Free,
It's free.
free.
So
Yeah.
yeah,
It's one of
library.
the last things. Okay, but that's a whole other topic. So we'll go down that rabbit trail. So basically, I think my advice would be to take some time to start learning about your body. I mean,
Yeah.
if you're interested in the resources that I've created and cultivated, if you liked this conversation, you'll love my first book, The Fifth Vital Sign. If pregnancy is something in your future, even if you're
Mhm.
not trying to conceive right now and you're just wanting to normalize your cycles, that's
Yeah.
why Lily and I wrote Real Food for Fertility. So the the good news is that there's a lot of resources out there
Yeah.
for if you're wanting to connect with your cycles and start charting. I think, we could talk a little bit about that. That's a whole other topic. But
Mhm.
even if you start by, downloading your favorite period tracker app, just paying attention to when you get your periods, start learning about cervical fluid. Cervical fluid is associated with ovulation. And when you have cervical fluid in the pre-ovulatory phase, those are the days that you're fertile. So
Mhm.
it's just, I would just, you're in an information saturation. I think the challenge actually for your generation compared to mine is that there's so much information and not all of it is
Right.
great. So you
Yeah.
have to kind of like try to find a credible source for it.
Mhm.
But the information is there. So that
Yeah.
I feel like you're in a good position.
I agree. And I think that this was a really good episode to like start conversations and give people a little bit more knowledge, and then definitely should go listen to your podcast and get as much information as possible. So, speaking on that, where can people find you?
Well, thank you for that. If you enjoyed this conversation, it's crazy, but probably by the time this episode comes out, I'm almost at episode 600 because,
Oh
like I
my
said, it's been like
gosh.
11 years of me pumping out episodes every week. It's crazy. Help my
Congratulations.
thanks. So if you search Fertility Friday, you'll find me. I'm the pink one. After
Mhm.
11 years of podcasting, there's another podcast with the title Fertility
Oh,
Friday now, but that's fine. I'm the pink one, so you'll find me. Uh,
amazing.
and if you want to find me on the socials, I'm at
Mhm.
Fertility Friday on Instagram. And yeah, if you want to get
Okay.
the first chapter of Real Food for Fertility for free, you can go to realfoodforfertility.com
Ooh.
and you can find me on fertilityfriday.com. So I gave you lots of links, but lots
Mhm.
of ways to connect.
Yeah, I'll put that all in the show notes too so people can just look and click on what they want. But thank you so much for coming on the podcast. I think this was awesome. Um, so much information. Thank you so much.
Thank you for having me. This was fun.
Before we wrap up today's episode, I do want to share something that feels very aligned with today's episode. If we're talking about menstrual health as a vital sign, we also have to talk about actually supporting it, not just suppressing it. Samine Health is a science-backed women's health company focused on hormonal balance and cycle support. Their formulations are designed to work with your cycle, not just override it, using clinically studied ingredients that support inflammation, cramping, mood, and hormone regulation. What I appreciate most is that they're not just promising miracle cures, they're focused on research-driven support for real symptoms, the kind of symptoms that so many of us live with every single month. If you're working on reconnecting with your cycle, supporting ovulation, or just feeling more in tune with your body, I definitely recommend checking them out. You can head to saminhealth.com to learn more, and you can use code Chronic Chronicles for a discount. And I'll have the link in the show notes as well. Thank you guys so much for listening to this week's episode. I am so grateful to Lisa for coming on the show and for breaking down something that honestly should have been part of our health education from the very beginning. The idea that our menstrual cycle is not just about reproduction, but it's a vital sign, just like heart rate, just like blood pressure, just like your temperature, is something that I think is a really interesting concept. Whether you're trying to conceive, avoiding pregnancy, navigating endometriosis, or just dealing with irregular cycles, this episode is a reminder that ovulation matters and your cycle matters. And more importantly, you deserve to understand your body. Lisa has done some incredible work in the space through her books, The Fifth Vital Sign, the Fertility Awareness Mastery Charting Workbook, and Real Food for Fertility, as well as through her podcast, Fertility Friday. If today's episode resonated with you, I highly recommend diving deeper into her work. As always, if this conversation shifted something for you, if it reframed how you see your cycle, your fertility, or your health, I would love for you to share this episode with a friend. You can screenshot it, tag us on Instagram, or just let us know what stood out. Thank you for being here, for being curious about your body, and for continuing to have these conversations with me. I'll see you next time on the Chronic Chronicles.